Hey there everyone, I'm Dr. Sam Dubé. I'm here to talk to you today about hip joint pain, its symptoms, the underlying cause, and the benefits of different treatment options. The symptoms of hip joint pain include pain that may manifest during movement or when sitting or lying down. The pain may be severe, making walking difficult or even intolerable. Aside from pain caused by trauma, hip pain is very common, with a range of potential sources that include the actual joint, the surrounding soft tissue, or related muscles. What causes hip joint pain? Well, in addition to trauma, the cause of most hip-related pain is acute or chronic maladapted neuromuscular function. Acute functional problems occur when the body is pushed beyond its everyday functional capabilities. Chronic functional problems occur gradually when everyday activities don't promote healthy function. Usually, these problems don't cause pain or discomfort until the stress-related tissue damage builds to the point that it impedes movement. In either case, most hip-related functional problems occur because of poor or maladapted neuromuscular function in the feet. There is a direct biomechanical relationship between foot function and the way the legs and hips function. An unstable foot with a poorly functioning arch system will result in poor bone alignment and imbalanced muscle use throughout the legs and hips. Over time, this maladapted foot, leg, and hip neuromuscular function becomes the norm and is the major contributing cause of virtually all non-traumatic hip joint pain. For proper function, our feet require the right stimulus and the right movement. Right stimulus consists of the subtle, varied stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimal muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches even before our feet contact the ground to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically to respond to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent the imbalanced muscle function that contributes to collapsing arches, which result in poor bone alignment and imbalanced muscle use throughout the legs and hips. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and simply stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuning out of the brain is actually natural. It happens all the time. The same thing happens when we walk into a room and first smell the coffee. After a few minutes, we don't notice the smell at all anymore. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is so critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Impaired right stimulus and right movement increase the strain and damaging stresses at the hip. Conventional treatment methods for hip joint pain include the following: supportive products such as orthotics, bracing, therapeutic exercise, corticosteroid injection, and replacement surgery. While these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the true cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. But these old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown us that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes hip joint pain and prevent it from recurring, I recommend the following: walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use Biopods stim soles. For best results in conventional footwear, use Biopods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use Biopods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Don't forget to consult with your primary healthcare practitioner and to ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.